Greg McCann, paramedic student at Pierpont Community Technical College. This is a primary patient survey. You start with a general impression of your patient. As you walk in the room, you're going to obtain the sex, you're going to ask for an age, and you're going to get a weight of the patient. You're also going to use a few acronyms to help get some of this information. You're going to use acronyms like FEDSO, you're going to use an acronym WARF, and you're going to look at the skin. Is it red, white, or blue? In FEDSO, it stands for face, eyes, dress, speech, and odors. So you want to look at their face, see what type of distress the face gives you. You want to look at their eyes. Do they look tired and weathered and weary? Look at their dress. Did they get up and get dressed for the day, or are they just lounging around in the pajamas, the muumuu, whatever it would be? Whenever you talk to them, listen to their speech. Is it full sentences, or is it one or two word sentences? You also want to take notice of any odors in the area and on the patient. If you walk in, they have a strong odor that indicates they have not taken a bath for a few days, then it may just be it. But if you also walk in and you get a strong ammonia smell, like there's a litter box that hasn't been emptied in months, and you don't see a cat, you may have walked into a meth lab. Use the acronym WARF, W-A-R-F. It's for work of breathing. Are they really struggling to try to breathe? Do they have abnormal speech or abnormal posture? Is there any retractions? Are they having problems breathing? Do you see it within their intercostal muscles? And look at their nasal flaring. Are they really struggling to get that breath in? So you want to pay attention to that. Look at their skin. Is it red? Is it white? Is it blue? These are patriotic patients that we have here in America, so this should be pretty simple. If their skin is red, you want to pay attention to it. Do they have a fever? Are they sunburned? Is this possibly allergies? Carbon monoxide poisoning? You never know. If the patient is white, are they in shock? Are they anemic? You want to pay attention to these people as well. And our blue patients, these are cyanotic people. They're not breathing well, and we need to address this issue soon. Determine this patient's mental status. We're going to use an AVPU method, alert, verbal, painful, unresponsive, and see how they respond to us. Determine their chief complaint. If they're talking, they should be able to tell you. But if they have altered mental status, you may have to rely upon somebody in the room with you to tell you what's going on. After you determine their chief complaint, you want to check the ABCs, starting with your A's and B's. You want to assess their airway. Are they breathing? Are the respirations too fast, too slow? Is it secure? Do you need to open this airway? Do you need to secure this airway? Is there equal rise and fall of the chest? And do they need oxygen therapy? Whether it's by nasal cannula, non-rebreather, is it going to come down to you have to bag these patients and intubate these patients? Check for circulation. This is the C in your ABCs. Look and control any major life-threatening bleeding that you find. That should always take place right away. Look at their skin color, like I said, red, white, or blue. Look at the texture, the turgor, and feel a temperature. Are they hot? Are they warm? Are they normal skin temperature? Are they cool, clammy? You want to take note of all this. You want to assess. You want to assess the pulses, but you want to start at the wrist. You want to do the radial pulse first. If it is not there, move to the carotid pulse, see what you get. Whenever you do feel the pulse, we're not counting the pulse. We're just going to take a moment to say, this is a fast pulse, this is a slow pulse, this is good, this is bad. After we have it done that, we're going to check disability, and we're going to look at their eyes. I'm old school, I see pearl, pupils equal and reacted to light. So we want to make sure the pupils are doing what they need to be doing. At this point, you want to expose any skin for any injuries that you do find. And if this is a medical patient and you're working cardiac arrest, you can't shock through a shirt. So you want to expose that chest so you can apply your pads. And from here, you will determine, is this patient a load and go or a stay and play? You always want to make these patients some sort of a priority, so you will be able to get the proper care to these patients that you need. And at this point, this is the end of my primary patient survey.